My name is Steve Wolf. I'm an orthopedic spine surgeon in Camp Hill, Pennsylvania. And my practice consists of patients with all different types of spinal disorders in the cervical, thoracic, and lumbar spine. A lot of them have spinal stenosis. They can have spinal cord compression, and a lot of them have balance issues. So the Voxx products really match well with my patients. They help them with their balance, with stability. It helps them with their neuropathic pain. I have patients with Parkinson's. It helps with their tremors. I have patients with MS. I have patients with other neurologic deficits. The Voxx products really help out with conservative treatment. It helps with their overall daily activities and improves their quality of life. I've also used it in my post-op patients quite a bit. I'll put the Voxx treads on some of the patients, and even the physical therapists in the hospital notice the improvement in their posture, their gait, their stability, and their rapid improvement after the surgeries. I've had patients with spasticity from spinal cord contusions and spinal cord pressure, and their gait has improved dramatically. They don't have the spastic gait. Their balance is better. Their posture is a lot better, and it really helps with the healing process after some of these big spine operations. I think about using the Voxx products on almost every patient if it's going to help them. And like other treatment modalities, nothing's 100%. But I think once you do a demo on the patients and show the difference in their stability and their balance, you get the eye popping and they don't believe what you're showing them. A lot of times I'll put a patch on a patient if they're having significant issues when I see them in the office. And sometimes with office hours, it's difficult to take time out to do a demo, but when I can, when I feel it's really important, I'll go ahead and do that. And just putting the patch on their forearm makes a dramatic difference. I recommend the Voxx products to my patients because they're something that is a conservative treatment. There's no side effects, and hopefully they will help. I mean, they have shown improvement in a number of different conditions that I've seen. As I said, with neuropathic pain, I see patients with diabetic neuropathy, and they get some improvement. I see people with plantar fasciitis, Morton's neuromas, that I'm not necessarily taking care of as a spine surgeon, but I end up examining their entire body. So anything I find that the Voxx products would help with, I would go ahead and recommend it. We have our Voxx products in our brace shop, which is our DME, which is durable medical equipment location. So I can write an order for the patient to go back and look at the Voxx socks, the insoles, and the patches, and our technicians will help direct them and actually do demos on some of the patients. And we also have a website that helps out a lot. If they don't have the product in stock, the patient can order it online and get the product. So then when I see them back in the office for follow-up, they oftentimes are wearing the Voxx socks, which is always nice to see, and they rave about them. Like I said, some patients I don't think give it enough of a chance, but the majority of the patients get a huge improvement. I had a patient with Parkinson's disease with a significant tremor. And he was a clinical psychologist, so he was a very intelligent gentleman. And I had a pair of insoles in my shoes, and I took him out and put his feet on my insoles. And his tremor went away in 30 seconds. He got tears in his eyes, and it was really dramatic. And he ended up getting quite a bit of Voxx products, but he had better posture. I actually put the insoles in his shoes, and he started walking with them. His posture was better, his gait was better. Because Parkinson patients have a very classical shuffling gait, and they're bent forward. And with the insoles, he stood erect, and he did not have the resting tremor or the tremor that he had before the Voxx products, and he continues to have good benefit from it. Well, we were initially exposed to the product through our daughter, who has a autonomic nervous system disorder called POTS, which is postural orthostatic tachycardia syndrome. And she had a lot of problems with balance and stability and restless leg syndrome. And a friend of ours showed us the Voxx socks. And the first time our daughter put the socks on, she said, for the first time in my life, I don't feel like I'm walking on a tightrope. She had immediate stability. She could run up the stairs, which she couldn't do without falling. And she slept with the socks, and her restless leg symptoms went away. So I couldn't believe it because I work around the nerves all the time, and I couldn't see how a pair of socks could do all this. And my wife was adamant that I try them in the operating room. And I have varicose veins from long surgeries. I'll have 10, 12-hour surgeries. So I started wearing the knee highs with insoles. And after the first day, after operating for 10 or 11 hours, my legs didn't ache. And I felt more stable in the operating room. I noticed that my hands were more stable. A lot of times when I'm operating around the spinal cord, I have to support my forearms. With the Voxx socks and insoles, I could freehand things around the spinal cord and do difficult dissections without as much difficulty as I had before. So I'm really sold on it. Overall, I have seen it work so often. The majority of the patients get tremendous improvement, tremendous relief, and it's the gift that keeps on giving.